Conjunctional Epidermolysis Bullosa by Gretchen Kansier and Alex Thomas. Some children with this disease also get called butterfly child because their skin is so delicate it is like butterfly wings. Another shortened version of this disease is also called EB. Definition of conjunctional EB is a group of rare diseases that cause the skin to blister. The blisters may often appear in response to minor injury, heat, or friction from rubbing, scratching, or adhesive tape. In severe cases, the blister may often occur inside the body, such as a lining of the mouth or intestines. This is where people get called butterfly child because their skin is so delicate that it's like a butterfly's wings. This type is usually severe and becomes apparent at birth. A baby with this condition may develop a hoarse-sounding cry from continual blistering and scarring of the vocal cords. Someone with this disease cannot play sports or has to be very careful not to nick their skin and watch what they drink and eat and be very careful not to cause any new blisters. Diagnosis. Doctors can determine if the patient has the disease by looking at the skin. The blisters on the arms, the body, or the legs are very obvious if the patient has EB or not. The condition usually shows up in infancy or early childhood. Some people do not develop signs and symptoms until adolescence or early adulthood. Skin biopsy for immunofluorescent mapping also helps diagnose EB. Genetic testing is very important because it is an inherited disease. So is parental testing, because if someone in the family has the disease, it is most likely to be passed down later in generations. Signs and symptoms of EB. Fluid-filled blisters on the skin, especially on the hands and feet due to friction. Deformity or loss of fingernails and toenails. Internal blistering, including the vocal cords, esophagus, and upper airway. Difficulty swallowing. Skin thickening on the palms and the soles of the feet. Hair loss. Thin appearing skin. Tiny white bumps or pimples. Dental problems such as tooth decay from poorly formed enamel. If you have any of these signs or symptoms, report them to the doctor right away because you may have EB. Etiology. Most types of EB are inherited. For this type, the genes that help form thread-like fibers that attach to the epidermis to the basement membrane are faulty. This gene defect causes tissue separation and blistering in this deeper layer of the skin. A lot of people will say an example of EB would be if your skin was like a brick wall and the cement holding the bricks together was the protein that the kids are missing. So when they hit their skin, it breaks very easily, just like a wall would break without the cement between the bricks. Treatment. EB has no cure, though mild forms may improve with age. Treatment focuses on addressing the symptoms such as infection and itching, and preventing pain and wounds. Severe forms may cause serious complications and can be fatal. Bathing and unwrapping the wounds tend to help. This should be done every other day. This is the most painful part for the children because every time you unwrap a wound, skin usually falls off with it. Medications help control pain and itching and addressing complications such as cespis. Cespis is really important to avoid because cespis is an inflammation which results in organ damage. By clotting during cespis reduces blood flow to limbs and internal organs, depriving them of nutrients and oxygen. In severe cases, one or more organs may fail. In the worst case, infection leads to a life-threatening drop in blood pressure and called septic shock. Prognosis. It really depends on the severity of the disease. Patients with this disease could live to be about 30, but it may improve with age. But sadly, it has a very high death rate. Doctors that are treating patients with EB usually try to avoid deformities, swallowing problems if the mouth and esophagus are affected, fused fingers and toes, and limited mobility from scarring. A lot of doctors recommend patients with EB stay away from sports so they have less blisters. They try to focus on keeping blisters to minimal or how they are already. And sports and contact make it very hard to avoid new blisters. References. We mainly use online sources such as Mayo Clinic, Library of Medicine, and WebMD. Now a video on a boy who lives with EB every single day. Click the link below.